which sometimes happen, right? So at least it makes people fitter. And similarly, we use a lot of technology in the workplace. We are also looking at gamified learning, which is happening in our many of our industries today. Anytime, anywhere learning is the theme, because nobody wants to sit in a classroom for 5 days, 1 month, etc. So I think anytime, anywhere learning with some sort of hybrid classroom setups, etc. I think very, very different things which are happening, how we have to learn to grow with all these changes. And the other thing is I would like to talk about is there are, I think based on all these technology changes, I thought from my perspective, I was looking at what are the new metrics for us as individuals. I was looking at one of the things is human quotient, humor quotient. Humor quotient is in terms of like WhatsApp jokes. Probably we need to see how many WhatsApp jokes we pass on or read. Probably that's one metric we are looking at. Because invariably we see we are like a human being is like a monkey, and if some notification comes to our mobile, we stop all the work and look at the notification. I think we need to see how to stop doing that as well. At the same time, on the lighter side, definitely there's an element of humor quotient which has increased. The curiosity quotient is another thing which I am looking at with all the Facebook and other things. We're trying to see what others are doing. So we are forgetting what we are doing, but we look at what others are doing. And the other thing is about knowledge quotient. So one is we use Google extensively for searching. But one thing we need to keep reminding ourselves is we have to develop our own knowledge itself. Because in the future, when automation and robotics are coming in more and more, the human mind and the creativity needs to be leveraged even further than what we are doing today. Lastly, coming to this creativity quotient, I think that's what is very important for us to see how to increase the creativity quotient in all of us to get into the next level of maturity. I think looking at some of the I think hearing Dr. Nair would join this session, we were checking with a set of very young children. What would they do if they were to go on a picnic to the moon, and how would they prepare? So I think their expectations were very, very simple. They wanted a mobile for staying connected. They wanted snacks, good food, and water to stay healthy. And they wanted a sketchbook and paints and toys and bat balls, etc., to play on the moon. So end of the day, they wanted to stay connected, stay healthy, and stay happy. I think why I'm talking about this young generation, because these are the people who are going to take things forward, and the way they think is completely different. In fact, we need to also how to address some of these Gen Z workforce coming into our play. If you give them a laptop or a PC, probably they'll be shocked. They'll probably expect everything to be done on their own mobiles. I think we're going to have a different workplace environment in the next few years. I think, are we really prepared for it? Is always a question I keep asking myself, at least. So these are very, very, very clear. I think the youngsters are very clear with their priorities. But if you talk about whatever they've said, connecting people or staying healthy or staying happy, and that has been the basic thing for human beings for ages as well. It's nothing new as well, if you really reflect on it. So I think Digital India, I think it's addressing many of some of the issues. It has its own challenges. I'm not going to talk too much about that now. And the other thing is about cyber security and data privacy, which is a very important topic in the age of new technologies. Of course, we need to take care of it. It's like if accidents happen on the road, we don't stop motoring, right? So I think we cannot say that we cannot adopt some of these new things. So we need to see how to ensure that we put the regulations around it. Morning, I think we had this 6 hours, 7 hours, etc. One of the things is regulation, right? So I think we need to do that. And while we have definitely improved our quality of lives, there are some questions probably I can, the distinguished speakers can address in terms of how and when we have the adequate ratios of people required in terms of skills required. Doctors to patients is always a challenge. Teachers to students, judges to cases. I think we need to see how to apply technology to solve many of the problems related to all these topics. The other thing is about how we can ensure that poor population also have better access to many of the learning as well as healthcare. And also we need to keep re-looking at it. Are we literally getting into a programmed living, or we are trying to get creative and change our living styles? I think that's very important. And so other thing is about the legal ethical framework of coping with all these new technologies. And probably the distinguished speakers could answer on what is the life we are imagining 20 years, 30 years down the line, and how we are building technology to suit the lives of people. I think these are a few things I thought I will cover, and I leave the stage to the distinguished speakers to take it forward. Thank you. Thank you.
Thank you. At the very outset, thank you to the MMA, to the organizing committee, to Group Captain Vijay Kumar, to Suresh and Dr. Nair on stage for being here with us. Thanks to all of you for being here with us to spend the next hour and a half on what I hope will be a productive conversation in terms of how I think technology is helping actually change lives. Really quickly, let me start by asking you a question, all right? And with a show of hands, let's see, do you like stories? How many of you like stories? Brilliant, okay. So let's talk about stories. Conventional definition of a good story is one that has a fantastic beginning and then has a really compelling middle section, which is the story and how it has its characters in it and how it develops the content and the way forward. And always, without exception, it doesn't matter the type of genre or the type of the movie that gets made, the ending has to be really fantastic. Do you all agree? Show your hands. Good. So today, I'm going to try and take the next 15, 20 minutes and give you a set of stories, right? All right. And before we dive into this, there's typically 7 types of stories, right? You can go and Google it or your search engine of preference, but go find it. Today's set of stories will be one which is about a quest, where the hero is basically on a quest to try and win whatever that he's trying to pursue. Think of like a Bahubali type of a movie, right? The guy's pursuing his love and he wins and he comes back and he wins his kingdom and everything. And then there's a horror story here, right? A horror story is one where there is something that is quite frightening, and if the collective us do not step up as heroes and address it, it is going to end up with a lot of really sick and or dead people. Typical horror story, right? And then there's another type of story here, again, which is premised on us acting collectively as a society, as a group of individuals, as a group of leaders, and that's the story of a tragedy. If we don't act, then we will see a tragedy that will happen. I'm not trying to get morbid here, but the point is that the conversation here is about something that impacts all of us as Indians and probably impacts all humans across the globe. All right? So let me dive right into the Apollo story. So here he is. This is Dr. P.C. Reddy. He's a cardiologist by training. He came back because of a story. He came back to India in the late 70s because his mom and dad said, your country needs you, but they didn't say come back. He made the call to come back. He came back, and in 1983, he started the first Apollo hospitals right here in Greaves Road, Chennai. Have any of you visited that hospital by any chance? Show of hands. Okay, brilliant. So all of you know the story behind the story, right? It started as a 150-bed hospital. Today, it's a 559-bed hospital. It's a JCI hospital, and it basically caters to folks from across 45 countries. On any given day, we see upwards of 2,000 plus patients. On any given day, we have an excess of 10,000 people that come in and out of that really small campus. I know because I used to run that hospital. I ran it for 3 years. And I've since then taken up this new role, which is this acronym, Chief Digital Innovation Transformation Officer. I'm still trying to get a hold of it. But the point is, there is a story here. This is a story of the quest, a person that has come back to do something for his country and for his people. Now, this is, again, a bit of a dated map, but this basically gives you the size and scale and scope of the Apollo Hospital Enterprises Limited. We play in all sectors in the healthcare space. And the timeline of how we started, and I guess the key takeaway here is, and I'll get to key takeaways, but the key takeaway here is, if you put your time and mind into anything you pursue, then success is yours for the taking. Today, we have in excess of 2,850 pharmacies, which make us the largest retail player in the country. So I'll let that sink in for a second. We are at our core, we are a healthcare organization that provides healthcare services but we're now in the retail space, and we happen to be the largest retailer in the country, right? So that should spark your mind going, wait, that probably means millions of interactions on a daily basis, which cascades petabytes of data, right? So there's data right there. We have 71 hospitals across the country. We have also a few facilities outside the country. We see in excess of 3-4 million people a year. Now, this is the entire ambit of the Apollo ecosystem. So we run the gamut of hospitals, clinics, we have standalone daycare centers, we have obviously pharmacies, we have a research foundation, we have a health insurance company in partnership with Munich, which is a German-based company, and we have a knowledge vertical, and then we have colleges and nursing schools. And again, I'm sort of setting the stage here in terms of what Apollo has seen, which I think speaks to the journey that the country is on in terms of its healthcare services. We have over 5,000 plus, and now up to 8,000 doctors across all of our facilities, taking clinics and everything. We have 50 specialties, and the new wave in healthcare is to offer subspecialization and super specialization. We have all of that, and I'll talk to you a bit about that also. All right, here's the money slide, right? This is your typical flow into the hospitals and the different centers. On any given day, we see excess of 30,000 footfalls, 2,200 admissions, 600 major surgeries, and I'll let you go through the list here. But the point here is, and somebody spoke to me right before my session here, he said Apollo is its own ecosystem, and he's absolutely right. On any given day, across one of our entities, there is a story that gets created. Typically, it's a story where there's perhaps some pain, and they're looking for some relief. Sometimes it's joy, where they're perhaps having a remission of sorts, if it's an oncology-based type of admission, or it's where a child is being birthed into the world as we speak. So we get to see a span of interactions across all of our touch points. And that also leads to, again, the takeaway here is lots of data. And many of it is unstructured data, so it's not really captured in a form that would let us make sense of it, which is what we're trying to address. So let me get to why this is important, right? To me, and I guess what both Prakash and Suresh did not mention, but I will, I've lived outside the country for 17 years, right? And so I've had the opportunity to basically understand how business works in the US, and I've run global enterprises, and I've come back here because I am from Chennai, and Chennai is my hometown. My mom and dad live here, and I came back because the opportunities that this country presents is immense, and I wanted to be part of that conversation here. So when I came back to take up my position with Apollo, I got to work with Dr. Reddy quite a bit, and I still do. And the takeaways here really about this story is the fact that he started Apollo in his early 50s. He was a startup when he was in his 50s. And in the short span of 30-some years, we're close to about a 19,000 crore market cap company. The takeaway here, which he always tells me, is belief is power. So I guess my first sort of lesson learned for me personally, which I'm sharing with all of you, is you must believe in whatever your dream is and you will accomplish it. The second takeaway is, if you can get a group of people to believe in a cause, then they will come with you for the journey. Many of our employees at Apollo Hospitals have been with the system since day one, and even before day one. When Dr. Reddy came back, he was practicing medicine at the HM hospital. And he's kept all of his employees with him throughout this entire journey here. And that is important because there's legacy and history, and again, context and data that we can use in order to provide the services that today's consumers desire. All right, so let's quickly move into India's healthcare story. This is where is it a tragedy? I don't know. Is it a horror flick? I don't know. Is it a quest? It could be a quest for all of us if we decide to act on what needs to happen, right? So let me set the stage. So on this side is where you have the different parts of the industry, right? The healthcare industry is expected to grow about 22 to 23% on a compound annual growth rate. And it's expected to be a 280 billion USD industry by 2020, right? So I'll let that sink in for a minute. That basically tells you that this is an industry that's here to stay, and it continues to grow exponentially, and there is a lot of room for all of us to play and grow in this industry. The medical tourism industry is expected to grow to about 6 billion again by 2020. And it's growing at a really rapid clip of 20 to 25%. Medical devices, 2.5 billion by 2020, again growing at a really rapid pace. Telemedicine, again growing at a rapid pace. And then also devices, which is again growing at a rapid pace. But the key point is, there is lots that is happening in this space, but all of that won't matter because of the tree that you see on the other side. India is the NCD capital of the world. NCD is an acronym for non-communicable diseases, right? And basically what that means is we collectively as a society are not taking care of ourselves. So we will see a significant uptick in NCD type of diseases, cancer, diabetes, breathing difficulties, cardiac issues, etc., if we collectively as a country do not act. And all of this is germane to this session because the solution that Apollo sees in order to address these inequalities and access to quality healthcare is technology. So I've listed a couple of the challenges that we have here, and I think collectively as a society, these are challenges that we continue to face. And I'm going to pick on a few just to understand and share with you the context of why we're doing what we're doing in this space. First and foremost is the variation in care. Really quickly, do any of you know how many hospital systems we have across the country? And I'm including mom and pop nursing homes and such. Any guesses? The size, how many hospitals we have? Shout out some numbers, it doesn't matter, you're not going to be wrong. 10 million? No, you're wrong, sorry. That was a bit excess. But you know, it's roughly around 5,000 plus hospitals across the entire country, right? And the point about variation is you will not know what you're going to get depending on where you end up, right? And that's a big problem. That's a big problem because we have millions and millions of Indians that are getting services from entities that perhaps have not the best clinical practices in play at this point, that perhaps are not learning from their experience, or perhaps not using the data to advance the cause of medicine. Another big problem that we're facing currently as a nation is the fact that the population is aging as we speak, and the supply and demand challenge is another challenge that we as an organization have and the country has. The number of clinicians that we need to provide the services that are required to meet the needs of 1.3 billion people is nowhere close. We don't have enough people. So all of this goes back to the point of how can we try and leverage technology to actually change lives. And the context of where all of this is happening is also from us, the consumers, right? The expectation in terms of how we would like to be served, that's changed. I mean, in the 34-year journey that Apollo has taken, when it started, there was significant information asymmetry. The clinician basically would tell you what the problem was, and then you had to trust him, and then you would, do what he or she would recommend you do. But today that's changed. We have Dr. Google that goes in and gives you advice on what your problem is. Dr. Google can also perhaps suggest some solutions. And then what happens? We as consumers, we show up at these hospital systems and we say, you know what, I read this up on the web and you all are doing this wrong and you need to fix it. So that's the context of where we're working, right? And also it's now truly a service industry. While healthcare you would think it's really about fixing problems, it has gotten to a point where consumers are saying, wait, we're paying you X amount of rupees for these services being rendered. While my clinical outcomes were fantastic, the fact that I didn't have a good service experience makes me less inclined to come back to you for services, right? And today's consumers all have a platform. So if I had a bad experience at an Apollo, then I will go back and post it on Facebook. And that sort of gets propagated to the entire universe. And usually where it was a unidirectional communication, organizations are typically now playing catch up in terms of how we respond to all of these things that get posted on social media. So the point is, on the one hand, we have diminishing margins in terms of how much money we have to spend in order to provide the best world-class services in any of our entities. And the prices are dropping as we speak, and the consumer expectations are skyrocketing. So again, the solution that we sort of are leveraging is technology, and I'll try and show you some of those instances here. Again, it's an eye chart on purpose. The person in the middle is your typical consumer, and this is a typical buying circle, if you will. What we have learned in our spaces, the consumption and purchase of services has now completely changed. Back in the day, it used to be, Anga Chananga, Yonga Chananga, right? And I will listen to somebody else's recommendations, and this physician is good, so we will go to him. It is now different. Today's consumers will Google, again, the individual providers, and we're starting to see rating agencies in our country that will tell you how good or bad the provider is. And again, still, it's very much a consumer perception-driven rating, if you will, right? Nothing's really driven by the data yet. And that is an arena where there is significant opportunity for people to come in and create something, right? But the point also here is, as consumers, we are confused. And the information asymmetry that used to exist on the clinical side has now shifted to the selection of services side. And that's something we're trying to address through how we can communicate to all of us as to why you should choose a particular provider versus not choosing a particular provider. And the other point I want to also highlight is all of this, right? This is ultimately, it comes back to one clinician and one patient. And while we treat millions of patients, we're looking at data in terms of what is the experience for one individual, right? And the context of our interactions typically happen with so much emotions into the conversation. I'll give you an example. Any given time, if you see one of our hospitals here, it's extremely busy. Take Chennar Main, for example. We get patients from all across India. So we have employees that speak all the different languages. And when they come in, and I learned that when I came back here, Indians don't visit physicians by themselves, right? They bring their mom and dad, and they bring their wives, and they bring their kids. And so the entire family is there for a visit. And it's the job of the organization to try and create an environment where the family, while it's already in a state of stress, is not stressed more by the environment that they're coming into. And these are the type of challenges that we're facing. And again, we're leveraging technology to try and drive through some of these issues here. So we said, okay, let's look into our crystal ball and let's see what we can do to try and address this, right? So traditionally, the conversation has always been around patient gets sick, he or she will come in, and then we will try and come up with a diagnosis of sorts, and we will try and deploy a solution that works, and God willing, and your clinician's expertise willing, he or she will get better, right? Now, what we're doing is we're going upstream. So basically, what Apollo is pushing for, and what Dr. Reddy is pushing for, and what we're pushing for collectively as an organization is don't get sick. We don't want you to get sick, right? So rather than showing up at some point downstream when, because of choices you have either willingly or unwillingly made, you get sick and you come to us, we're saying we'll partner with you and we will try and help you stay healthy. And that's the paradigm shift that we are trying to deploy in all of our services, right? So now the mandate, the push that we're aggressively communicating to all of our consumers across the country is get a health check done. You don't have to do it at Apollo. So here's my quick message to all of you smart people in this room. Get a health check done. Because if you do, it doesn't matter again where you get it done. That will at least give you a baseline as to where you are today. And then there's a million ways to get healthy, right? So quick show of hands. Will you get a health check done? Brilliant. Some of you haven't lifted your hands, and that's all right. I sense there's a bit of apprehension about the discovery process. I hear you. I used to be one of those people, but I had to as part of my employment at the organization, and I did all right. But the point is, do it, because if they do find something, then usually they can give you some solutions, right? It's better to know than to not know and then discover at some point where the fix is more expensive, more interventional, more radical. And so we have moved, and what Suresh was alluding to, where we're starting to look at the data. Now, if you remember, I spoke about the fact that when we started in 1983, we are a 150-bed hospital. Today, we have in excess of 10,000 beds across all of our entities, right? We're the largest integrated healthcare provider in Asia, while the ranking keeps changing because new. Thank you. But I think for us, the biggest epiphany through the journey that we're now taking is the fact that we have all of this data that gives us truly a view into how healthy or sick India really is, right? Because a typical interaction for a patient in a tertiary care setting can run the gamut of anywhere upwards of 40 to 50 people, right? Between the labs and the diagnostic imaging and the conversations with specialists and conversations with dietitians, and it runs the gamut, general practitioner. So all of these interactions are giving us data, right? Which we are starting to use, right? So now we have gotten to the point, and I mentioned health checks, right? We've gotten to the point where we can do a genetic mapping of your profile, right? And we can do this for your mom and dad, and we can do this for your grandparents. And you're thinking, Subhaya, why would you want to do that? I'll tell you why. Because you love your kids. Yes? Show of hands. You love your kids? Yeah. I mean, no-brainer type of a question, right? What we can do is we can tell you if you or your kids are predisposed to certain type of diseases based on these markers. And then we can help you design a set of interventions that will perhaps preclude that from ever happening. That's the promise of medicine as we progress today, right? We have started to mine population data. So now we know certain parts of the country are predisposed to certain types of diseases. Now that's brilliant, because what that means is we can partner with the governments and we can tell them perhaps you must do these type of interventions as a public policy type of initiative, so that way you can address the needs of these people in these areas, because we know they will get these diseases if nothing happens, right? On the flip side, going from massive data, we're now going to individual data, right? Again, Suresh sort of alluded to the fact that, there's gamification and there's approaches where we're starting to track data. And I'll show you some of the interventions that we have already started. But we're looking at, the notion of quantified self. We're looking at knowing a person throughout his or her journey with the ecosystem, both when he or she presents at an Apollo entity and when he or she is at home, right? So we have devices that we've linked up with the consumer where we get data on a real-time basis. So for example, if I have a diabetic patient, when he or she takes a prick and checks his or her blood sugar levels, we are immediately notified in our control center here, and we can see, for example, what the numbers are. And what happens is if it is significantly out of range, we would have a nurse call up immediately and have a chat with the patient, right? So let me quickly get to how we are actually deploying this. So this is a use case type of a story. I'm sure all of you heard of telemedicine, right? So this is in Himachal Pradesh, we run on a public-private partnership, first of its kind, I think, in the world. We run 2 telemedicine centers at Keelong and Kaza. These are the highest civilian telemedicine centers in the world, right? And this is a partnership where this is part of India. These are Indians, and these are challenges that they have in getting access to fantastic quality care. And the approach we took was we worked with the government there, and we put together a solution that was also cheaper than what they had at that point. And the commitment from our side was to take care of patients through the OP services and then any tele-emergencies of sorts. And I'm rushing through some of these slides because there are some videos I would like to quickly show you, if that's all right with Suresh. Here's a fantastic case study, right? There's a monastery up there, young children, young monks that were running around, and they had what's called tinea capitiosus, which is fungal growth in the head. In the past, they would have no access to a world-class dermatologist that sits at Apollo Hospital Chennai here, but he diagnosed it, and here's the interesting part. Because these monks were sharing their personal belongings, towels and such, because they're monks and they do that, it was an epidemic at that point. But because we could catch it, we could fix it. And that's the power of technology here. I mean, can you imagine monks living in Himachal Pradesh having access to some of the best dermatologists in the world, right? This is what technology can actually do for us. Here's another story. We had a patient that had an acute MI, and we basically stabilized the patient remotely from here, where the star consultant here did the intervention on a mannequin here, and the young resident doctor there learned on the fly and saved the life of this person here, who was then evacuated. I'll see if I can play a quick clip if it works. Yep. And again, this is a neurosurgeon, and he's looking at the readings of one of his patients from there. So here's the story though. The takeaway is we have done over 11,000 some OP visits of these Indians in that remote part of the country. We have intervened and saved lives in over 1,000 plus emergency instances. And here's a split of the data in terms of how are these diseases presenting in that part of the country. Again, the data that we're leveraging to try and drive the way forward for the country. This is a small video of one of those patient stories. And I want you to see it because this is the power of technology. How, if we work together, we can collectively make a difference in people's lives.
राम सिंह हिंदू गांव का रहने वाला हूँ। मैं एक किसान हूँ जी, खेती बाड़ी का काम करता हूँ।
It's quite an amazing experience being connected to people living thousands of kilometers away at a height of around 14,000 feet for the sole purpose of being there at the times of their dire need.
5 बजे उठ के चले जाते हैं खेतों में काम करने। काम करके आया मैं वापस खाना खुना खा के फिर गाय गोय निकाल दिया था जी। उतने में थोड़ा सा मामूली शुरू में सांस बंद होने लग गया मेरा। फिर मैं सोचा क्या हुआ ये, आज तो छाती में दर्द भी हो रहा है, सांस भी रुक रहा है, क्या है बात है ये। तो ज़्यादा बहुत ही खतरनाक हो गया जी, बहुत ही ज़्यादा हो गया दर्द। फिर कोई 15-20 कदम चलता रहा तो रुक के थोड़ा बैठ गया, आराम का फिर चला। फिर पहुँचे घर में आस पड़ोस के कोई 2-3 भाई आया घर वालों ने, बोला यार ऐसा ऐसा हो गया, पता नहीं क्या हुआ इसको। उन्होंने देखा, बोला यार कुछ नहीं होने वाला है, ले जाएंगे कहीं अस्पताल में। अपने गांव के नज़दीक डॉक्टर ने बताया कि बोला केलंग जाओ, आपको वहाँ उन्होंने और टीबी के थ्रू जो बड़े डॉक्टर से वो बात करवा के आपका ट्रीटमेंट करवाएंगे। फिर यहाँ ले आए जी केलंग में। यहाँ मेरे को पता नहीं, उसके बाद मेरे को पूरा याद भी नहीं था जी।
रामसिक पेशेंट आए थे, वो 4 PM अराउंड आए थे और उनका कंप्लेंट था कि चेस्ट पेन था और जो कि लेफ़्ट शोल्डर की ओर रेडिएट हो रहा था।
यहाँ लाया तो जी इन्होंने पूछा मेरे को, बोला क्या हुआ है, क्या कैसा है। मैं कहा यार मेरे को तो कोई वो ही नहीं है, बुरी तरह दर्द हो रहे हैं, कोई पता नहीं है मुझे या मैं बच जाऊँगा कि नहीं, मुश्किल बहुत ही मुश्किल है।
उनको देखते ही लगा था कि उनको इमरजेंसी की ज़रूरत है, तो मैंने इमीडिएटली डॉक्टर ह्यूबर्ट के साथ चेन्नई में इमरजेंसी में कनेक्ट करवाया था। तो उन्होंने ECG लेने के लिए कहा था। फर्स्ट जो ECG लिया था वो नॉर्मल था, तो मुझे लगा था कि पेशेंट को डिस्चार्ज कर देंगे।
But from my experience in the past, I knew something had to be wrong. This gentleman was particularly looking very uncomfortable.
अच्छा ऐसा जी मेरा छाती में दर्द होता ना जी, छाती में सांस बंद हो रहे थे, मैं बिल्कुल ही सांस तो ऐसा सोच रहा था कि मैं ख़त्म ही हो जाऊंगा अभी।
We kept him in the tele-emergency unit and closely monitored him for next 45 minutes. A repeat ECG after that showed an acute inferior wall myocardial infarction.
एवरी 5 मिनट्स उनके ECG और वाइटल्स में डॉक्टर ह्यूबर्ट को चेन्नई में वाया इंटरनेट सेंड कर रही थी।
We were tracking heart attack in real time with the minimal facilities available at Keelong. We took a decision to stabilize him in the tele-emergency unit itself.